Hi, it's Michelle. One of the things that happened with your child when they have special needs, but more so particularly with cerebral palsy, is we find that the infant teeth look good, but by the time the adult teeth start to come in, we have problems. Well, a lot of that can be avoided or worked with very early in age. With movement lesson, right, first of all, what we look at, so this is an infant skull, and we look at where I say more so cerebral palsy, because intubation comes into play, where they're forcing air into the tubes, cannulation, oxygen support, NG tubes, and so forth. Now, this can happen with rare genetics just as much as anything. The whole goal in your baby's birth is to keep your baby alive, right? And most of us don't have to think about those things, but in movement lesson, I deal with this on a daily basis. And I want parents to start understanding how medical interventions can affect movement, right? Whether it's you getting an IV or even stubbing your toe, it really sometimes doesn't take much to change the way someone develops. So when you have intubation, one of the things that happens again is a tube goes down, but this is very soft tissue. And if it's not done properly or if it's too abrupt, you can get a pretty severe palatine hit. But more so when they tape all of this up, you get the canines wrap around the tubing. So lots of times with a child with cerebral palsy, let's say, I'm here, but you'll start to see where the face comes back and you get more of the wrapping and the jaw can't close. Well, these are some of the side effects of intubation. Again, the infant teeth erupt quite nicely and come down. Now, another complication maybe if you're on seizure medicine, especially like Keppra and so forth, that one of the side effects is thickening or can be thickening of the gums. So now that eruption starts to get impeded. So here is a skull of a 6-year-old. Now, if you look here closely, you'll see again the infant teeth formation, but these are the buds coming in, and they come in, and they need to be actually quite straight and in a position to force the teeth out. So you'll see with the incisors that the eruption comes behind the main teeth, whereas the molars come right above, because again, you have a different root system on molars than you do with the incisors, a single versus a double or a tri. So when you have something like that now if you have anywhere where the maxillaries, these are your bones in your face, the zygomatics, even the zygomatic arch, because again, you've had cannulation and the hyoid bone hasn't come in to articulate. When these buds don't have a chance to come into position properly, and you don't see this happening, right? Because it's happening in your child's skull. That's where you have straight teeth in a sense, where they're infancy, and then the teeth really start to come in angles because they're doing what they can to force out and come into play. If the forcing out is interrupted due to, let's say, medications that are affecting gum alignment, or again, NG tubes, all these kind of things, I'm not saying don't do cannulation. We need oxygen support or all of that. But at the same time, please remember that when you are doing any kind of medical intervention, including like a PICC line, you are changing the way the body is able to respond to movement, which is the key to infant development. An infant just responds to movement. They don't have that conscious, I'm gonna go grab that ball. It's like they see a ball, they want to respond to it through their senses, their topical senses. But at the same time, when they go to look at something, let's say, and the oxygen or the tape has prevented that peripheral vision, then this is where the movements just don't have a time to develop. You want to learn more about that, please. I have great groups. First of all, I have movement lesson, but my private group, Movement Lesson for Parents and Practitioners, is where you can load your videos and discuss your child's movement development. It's not about the diagnosis, it's about your movement development. And the same thing too, now I have baby movements, my group there, and also have gravity and movements if you want to get into the science behind all of this, where I discuss all of this. I hope you have a great weekend and enjoy your children. Thanks.